Hello everyone, I am Seema Gupta from Ramesh Institute of Vocational and Technical Education. I am going to deliver the lecture for pathophysiology subject. The subject code is BP204T. See, in the previous lectures we have discussed the various diseases related to cardiovascular system. In today's lecture I am going to deliver the lecture for atherosclerosis. Now, the content for today's lecture is, I am going to discuss the definition, the types of atherosclerosis, pathology, pathophysiology, etiology, signs and symptoms, manifestations, risk factors, prevention and treatment. So, let us discuss in detail all of these. Coming to the next slide. Now, the definition. What does this arteriosclerosis or atherosclerosis means? Now, see, as the word indicates, arteriosclerosis, let break the word into two parts. Arterio means something related to arteries and sclerosis is hardening of arteries. So, anywhere the arteries where it is hardened, so we use the term arteriosclerosis. So, arteriosclerosis it refers to stiffening यानी जकड़ जाना and hardening या loss of elasticity of the medium and large arteries. So, this is in your syllabus atherosclerosis term is also given. Now, what is atherosclerosis? See, atherosclerosis it is a form of arteriosclerosis only. What is the difference between arteriosclerosis and atherosclerosis? See, arteriosclerosis it refers to hardening of the particular arteries, whereas atherosclerosis is a type of arteriosclerosis only, where it is caused by buildup of plaque in the artery. In the artery there is deposition of plaque. Now, what is plaque? Plaque it is a like fat or cholesterol type substance which are deposited in the arteries. So, a specific form of fatty plaque which is deposited, that we call as atherosclerosis. Okay. So, let us move further. Now, the different types of atherosclerosis, what are the different types of atherosclerosis? So, first one is the arteriosclerosis obliterans. What is arteriosclerosis obliterans? See, it mainly affect your medium and large arteries of lower extremities. Lower extremities means lower portion, lower legs and all, these are involved. Then it is also characterized by fibrosis of intima. Fibrosis of intima, you know, in the blood vessels there are three layers. Like suppose this is the blood vessel, it comprises of three layers. The inner one is called tunica intima. Okay. The inner one is tunica intima, the middle layer is called tunica media, and the middle layer is tunica media and the outermost is tunica externa. Okay. So, now what happens, see, in these three layers, if there is fibrosis of intima means the innermost layer there is a deposition of fibrous connective tissue. So, where it happens? In this type of arteriosclerosis. Okay. and calcification of media means the middle layer there is deposition of calcium. Okay. So, obliterans is characterized by three things. Number one, it affects medium and large arteries. Number two, there is deposition of fibrosis is there in the intima, and there is a deposition of calcium in the media. So, this you called as arteriosclerosis obliterans. And next, coming to the medial calcific sclerosis. See, as the word indicates, medial calcific means in the tunica media layer there is the calcification. So, calcification in the tunica media, that is the middle layer, but there is no thickening in the intima, whereas here there is a thickening of intima, there is fibrosis in the intima, whereas in this medial calcific there is no thickening of intima, and it mostly occurs in the elderly. Okay. So, these are the types of arteriosclerosis which I have mentioned. Now, coming to the next, the pathology. See, pathology, like when there is an atherosclerosis is there, what actually happens? How the fatty accumulation is there? So, this was explained. The number one, there is a fatty streak. Fatty streak is what? The macrophage cells. You know, understand what are macrophage cells? These are type of WBCs only, they engulf the foreign particles. So, macrophages, in the macrophages cells there are lipid deposition. So, fatty streak, wherever the word fatty streak comes, you have to understand it is a yellow streak, yellow in color of what? Lipid filled macrophages cells. The macrophage cells, they are filled with lipid, and it appears as yellow color, yellow streak. Then there is a fibrous plaque, a whitish yellow lump, that is called the fibrous plaque, and at a time the plaque rupture. When the plaque rupture, it causes aggregation of the platelets, the activation of the platelets, and as a result it causes thrombus formation. So, in the atherosclerosis or in the arteriosclerosis, you will study all these phenomena, like fatty streak is there, or fibrous plaque is there, or the there is a thrombus formation will be there. Okay. Now, here in the diagram it is clearly explained. By this diagram you will be able to understand how the atherosclerosis occurs. See, this here it is shown the blood vessels. This is the normal blood vessel where there is no deposition of plaque, there is no atherosclerosis here. The normal blood flow will be there, it is clearly visible. Now, in case of atherosclerosis where plaque accumulation, these you see this is a yellow in color, yellow streak. Okay. So, this is the plaque deposition here. When there is a plaque deposition, it is clearly seen the pathway is reduced. Here the pathway is open completely, the blood is flowing, but here the pathway is limited for the blood to flow. So, limited amount of blood will flow there, and then the limited amount of oxygen will also flow there. So, there will be a decreased amount of oxygen to the heart. Why? Because of this plaque deposition. And after some times what happens, this now plaque build up is there, and there is a platelet aggregation is also there. As a result, this completely, these are the platelets, aggregation is there. The blood clots, they completely block the pathway. So, the blood will not able to flow. As a result, there will be no blood supply or no oxygen supply when there is completely blockage. Okay. So, this will clear to you. Now, coming to the pathophysiology. Pathophysiology, like why it occurs, what is the role, what are the factors which are responsible for this atherosclerosis. So, first of all, it is the endothelium role. Endothelium, you know, the inner lining, the inner cells of the blood vessels. This endothelium layer, it secretes NO. NO, it releases NO, nitric oxide. Nitric oxide is released. Now, what is the function of nitric oxide? Say these endothelial cell on the endothelium layer, it releases nitric oxide, and this nitric oxide, it is a vasoprotective gas. What does this mean? That it acts as an antiplatelet. Okay. Like whenever there is an clot deposition or there is a fat deposition inside the blood vessel, the endothelium layer, what they do? They secrete NO, and when NO is released, the blood vessels dilate. First function. Second function, it acts as an antiplatelet. Antiplatelet or antithrombotic it acts as, so more of the cholesterol will not accumulate and thrombosis will, antithrombotic effect will take place. So, this endothelium function is very important. Endothelium should be functional for our proper living. So, like suppose what happen if there is any inflammation or if there is any toxins or due to certain drugs, the endothelium become dysfunctional. When endothelium become dysfunctional, what happens? Little of the cholesterol they started accumulating. Because the NO is not released, there will be no vasodilating action, there will be no anti-thrombotic action will be there. Okay. So, in that case continuously clotting will take place and the platelets they continuously accumulate in the blood vessels. Role of acetylcholine, it also stimulate NO release. So, NO is the vasoprotective gas, it acts as antithrombotic, that is breakdown of thrombus, and it also acts as a vasodilator, that is dilating the blood vessel. So, it is beneficiary to us that if dilate the blood vessel, then only the blood flow will take place. Now, coming to the next slide, see here the pathophysiology is clearly explained what happens, how the atherosclerosis it takes place. Initial inflammation is there, initial inflammation like any foreign substance or any chemical reagents or any drugs or whatever may the reason, they are causing inflammation to that particular blood vessel. So, what happens? The inflammation it causes endothelial dysfunction, the endothelial cells they are not functioning properly, they will not release NO. NO it acts as an antithrombotic effect, it shows antithrombotic effect. So, when there is inflammation, the endothelial become dysfunction, the endothelium will not function properly. So, what happens? When the endothelium is not functioning properly, what happens? The monocytes accumulate there. What are monocytes? Monocytes is a type of WBCs. See, wherever there is inflammation or such type of formation, the body immune cells are activated. So, where there is endothelial dysfunctions, the monocytes which are type of WBCs, their recruitment means they gather to the site of injury or they gather to the site of inflammation. जहाँ पे inflammation हुआ है वहाँ पे WBCs आके इकट्ठे हो जाते हैं. Okay, so that is called the recruitment of monocytes. After that, what happens? The smooth muscles cells they proliferate. Proliferate means they continuously divide. The smooth muscle cells divide होते हैं. After that, what it causes? The platelet activation and aggregation, which results into atheroma with thin fibrous cap. Like suppose this is the blood vessels and here the endothelial layer is dysfunctional, the cells they are not functioning properly. Now, cholesterol deposition is already here or any inflammation may be there the reason. Now, what happens? The smooth muscle proliferation, the smooth muscle cell it rapidly divide As a result, the platelets activation will be there and a thin fibrous cap formation is there. So, this is the cap which is formed over here. Okay. So, it will block the artery. This is what is taking place here. Now, coming to the cholesterol LDL, how this LDL cholesterol deposit in the tissues is responsible for atherosclerosis. First of all, you have to understand what is LDL. In the previous lecture, I have explained this, but I am just repeating it. LDL, it is the low density lipoprotein. There are two types of lipoproteins which are there, LDL and HDL. LDL, it is low density lipoprotein, HDL, it is high density lipoproteins. LDL is also called as bad cholesterol, HDL is also called as good cholesterol. Okay. Now, this LDL, because it is a bad cholesterol, so what happens, we have to reduce this LDL level. Okay, because as the LDL level it increases, it will accumulate and block the whole artery. Whereas, the HDL is called good cholesterol. Why? Because this increased level of HDL will help to lower down your LDL level. So, that is the beneficiary thing of HDL or a good cholesterol. Now, what happens when the LDL cholesterol deposit in the tissues? This LDL oxidized. Okay. The LDL oxidized, as LDL oxidized, it will kill the endothelial cell. See, when the endothelial cell are properly functioning, then there is no accumulation of the platelets, or there will be no blockage, or there will be no atherosclerosis. But only when the endothelial cells are dysfunctional, there will be platelet aggregation. Why? After the endothelial cells are killed, they will activate the macrophage cell, the WBCs will be activated, which will result into it will stimulate the smooth muscles and the fibroblast. So, what will happen? Ultimately, it will result into platelet aggregation. So, first of all, there is a cholesterol deposition and platelet aggregation, there is complete blockage of the arteries. Okay. So, these are the two steps for pathophysiology. First of all, there is initial inflammation may be there, or there is increased level of LDL. Both of them, what they are doing? They are destroying the endothelial cell and ultimately resulting into platelet aggregation. Now, etiology, what are the causes which are responsible for atherosclerosis? Number one is high BP. If the blood pressure is high or hypertension, it will ultimately lead to atherosclerosis. Smoking, the second factor is smoking. Smoking, what it will do? It will increase the LDL level, and when LDL level is increased, I have just now only told you that how the LDL level increase, it causes platelet aggregation. So, ultimately it will result into atherosclerosis. High cholesterol level, and high cholesterol also, if there is increase in the LDL and decrease in the HDL, they will result into atherosclerosis. Okay. Obesity, if the patient is having obesity, very sedentary lifestyle, lack of exercise is there, is not moving anywhere. So, what has happened? Continuously fat will accumulate there and it will block the arteries. So, all these are the factors which are responsible for your atherosclerosis. Now, coming to the signs and symptoms, see, depending upon where is the atherosclerosis, in which area there is the atherosclerosis, like if it is in heart, then other type of symptoms will be there. If it is in the brain, then different symptoms. If it is blocking the arteries of arms and legs, then other symptoms. So, likewise we will discuss the different symptoms. If the atherosclerosis in the heart, See, deposition of cholesterol in the heart arteries. So, what you will face? You will face the heart failure, sudden chest pain, angina will be there. Okay. Then atherosclerosis in the arteries leading to brain. When the brain arteries they are blocked, what will happen? You will not able to move your hands and legs, there will be weakness or numbness in your arms and legs. There will be difficulty in speaking, there will be slurred speech, vision may be lost. Okay, so these are the symptoms when brain is affected. Coming, if the arteries of arms and legs are affected. So, obviously, if the arteries of legs are affected, you will feel pain in the legs when you are walking, and there will be a decreased blood pressure in the affected limbs. Whereas, if there is atherosclerosis in the arteries leading to kidney, so ultimately it will lead to kidney failure. Okay. Now, manifestations, see manifestations means what happens or what are the, when a patient is suffering from atherosclerosis, what other disease he may also suffer. So, what are the manifestations? Now, there may be a coronary artery disease. The atherosclerosis can cause the coronary artery disease. What is coronary artery disease? See, you know the heart is supplying blood to whole of the body, but who is supplying blood to the heart? Coronary artery. Coronary artery is supplying blood to the heart. When there is a blockage in the coronary artery, so what will happen? The sufficient blood will not be supplied to the heart will not able to function. So, the heart muscle will die. Ultimately, it will lead to heart attack. Whereas, if in the cerebrovascular disease means if the arteries there if a patient is suffering from atherosclerosis and if there is a, it may lead to stroke. Stroke means the sufficient blood supply to the brain is hampered. ठीक है, यानी एथेरोस्क्लेरोसिस अगर आपके ब्रेन के अंदर है तो ब्लड सप्लाई विल बी हैम्पर्ड, ब्लड सप्लाई नहीं हो पाएगा एंड द पेशेंट में सफ़र फ्रॉम स्ट्रोक और द ब्रेन डैमेज. ओके. Risk factors, different risk factors like what different risk factors are there which may lead to atherosclerosis. See, first is the increasing age. As the patient age is increasing, his lifestyle is sedentary, बैठे रहते हैं, तो that will lead to accumulation of fats, ultimately atherosclerosis. Family history, if a patient is suffering from, if one of the parent is suffering from atherosclerosis, it will pass to the progeny, बच्चों के अंदर आ जाता है if there is a family history. Then obesity, sedentary lifestyle है, ultimately fat का accumulation होगा. Then post menopausal estrogen deficiency. See, after post menopausal मतलब menopause के बाद, after menopause there is estrogen deficiency in the females. So, this estrogen deficiency may lead to the imbalance in the lipid profile and ultimately may lead to atherosclerosis. Then physical inactivity, of course, it is clear. High carbohydrate intake or the intake of the trans or unsaturated fat, ultimately it will lead to atherosclerosis. Then hypertension, increase in the blood pressure is an important factor. Cigarette smoking, smoking again it will increase the LDL level, so that is dangerous. Diabetes, if a patient is diabetic, what will happen? Is lipid profile will be hampered and ultimately the patient will suffer from atherosclerosis. So, prevention, how can we prevent? We can prevent by decrease the smoking, cholesterol level should be decreased, blood pressure should be regulated, obesity should be controlled, stress should be controlled, because stress it lead to the release of certain neurotransmitters, and the exercise should be increased, the alcohol intake should be decreased. Ultimately treatment. See, lifestyle changes we have to do. Lifestyle changes means increase in the exercise level, decrease in the cholesterol level. So, that is the lifestyle changes. Coming to the medication, beta blockers. See, beta blockers, Atenolol, what if it will do? It will decrease the blood pressure. So, that you have to do. Atorvastatin, what it will do? It will decrease the manufacturing of the cholesterol. So, cholesterol will automatically decrease. Okay. Now, angiography and angioplasty. See, with the help of angiography, you can find out where is the blockage, like which coronary artery is blocked. So, a proper angiogram is obtained. A small catheter is inserted through your wrist or into the your groin also, it is a small catheter is inserted, and then after that a dye is inserted. So, particularly you may see that which artery is blocked, and finally angioplasty is done. Angioplasty ballooning is done or stunting is done, छल्ले डाले जाते हैं उसके अंदर. So, this is how you can treat the patient who are suffering from atherosclerosis. So, that is all for the today's lecture, and have a nice day. Thank you.